Good afternoon. Welcome to this Ask the Expert event focused on lung cancer. Today, a panel of experts will share helpful information about lung cancer screening, diagnosis, and treatment. Let's meet our panelists. First, we have Dr. Timothy Sherwood, a highly trained and experienced thoracic surgeon specializing in lung and esophageal cancer from Mary Washington Healthcare, Virginia Cardiovascular and Thoracic Surgery. Next, we have Dr. Philip Brandt, a hematologist and oncologist with Virginia Oncology Care. Dr. Brandt has practiced stateside and overseas and believes in a holistic treatment approach that includes a patient support system. We are also joined by Dr. Navid Mokhtari Amirmajdi with Northern Virginia Hematology-Oncology Associates. Dr. Mokhtari is a board-certified hematologist, oncologist, and internal medicine specialist. Next up is Dr. Christopher Vaughn, a board-certified hematologist and oncologist with Hematology-Oncology Associates of Fredericksburg. Dr. Vaughn has a special interest in lung cancer and values his interactions with each of his oncology patients. And finally, we have Donna Hebb, cancer nurse navigator from the Mary Washington Healthcare Regional Cancer Center. Welcome, and thanks to everyone for joining us this afternoon. Dr. Sherwood, I'd like you to start the program by telling our viewers a little bit about lung cancer, what it is, and why is screening for lung cancer so important?
Thank you, Addie. Lung cancer and cigarette smoking are major public health problems that have really been around for over 100 years and has led to lung cancer being the #1 cause of cancer death in the United States. And the number of deaths secondary to lung cancer exceeds breast cancer, colon cancer, and prostate cancer combined. So unfortunately, most of lung cancers that we see today in 2022 are diagnosed at a late stage. And the reason that's the case is because many times lung cancer doesn't present with any symptoms until patients have an advanced stage. We do know that lung cancer's primary cause is cigarette smoking, and over 90% of cases are caused by cigarette usage. And therefore, we launched some studies to identify patients who are high risk for lung cancer. And those are patients who are cigarette smokers. And we use criteria such as pack years to identify patients who are at high risk, and then utilize a low-dose CAT scan imaging to identify lung nodules that are not symptomatic but could be early stage lung cancer concerns. And those are patients that we then would follow and perform a biopsy or other diagnostic procedures to diagnose lung cancer.
Thank you, Dr. Sherwood. And you mentioned pack year history. We do have a slide coming up that will have a calculation for our viewers at home so they could tabulate their own pack year history. Right. Dr. Mokhtari, thank you. What are some symptoms that require diagnostic screenings?
Thank you so much. Well, it's a tricky question. I believe that the lung cancer screening tests are designed to screen lung cancer in asymptomatic patients, meaning that we should not even wait for lung cancer symptoms to show up. That means that having symptoms from lung cancer might be already late to diagnose lung cancer at a curable stage. So there are a lot of symptoms associated with lung cancers, including chest pain, shortness of breath, weight loss, cough, bloody sputum. Those are all signs of advanced disease. So as Dr. Sherwood informed us, this is the most mortal types of cancer in the United States. So screening is really important to prevent these symptoms to show up and actually diagnose the cancer at the limited stage. So to answer that questions, We should not wait for any lung cancer to show up, and we should start screening the candidates very early based on the history of smoking they have.
Thank you. That's excellent to know, not to wait for symptoms, but just to go ahead and get screened.
Yes.
Dr. Brandt, what are the different stages of lung cancer and are they treated differently?
Sure. So thanks for the question. So lung cancer, just like most other cancers, once it's diagnosed, they're often assigned a stage. And the stage of a cancer typically describes the size of the tumor and typically how far it's spread from where it originated. The way that we stage them beyond that is we assign them a number, usually from 1 all the way to 4, with stage 1 cancers typically being smaller cancers, more localized, while more advanced stages, for example, stage 4, usually implies that the cancer has spread beyond the point where it started from. This is important because assigning a stage to a cancer will often influence or often determine what would be the appropriate treatment for the cancer. And the treatments can vary from anywhere from surgery or potentially radiation, all the way through different types of treatment like chemotherapy and immunotherapy.
Thank you so much. Dr. Vaughn, can you tell us a little bit more about non-surgical treatment for lung cancer and what the goals of that treatment would be?
Yeah, definitely. Thank you for the question. Well, in general, when I think of a non-surgical approach, we're probably talking most of the time of already advanced cancer. Most of the time, unfortunately, probably stage 4 cancer, where, as Dr. Brandt was saying, it's already spread. So I think the important thing to discuss with patients at that time is the overall goals of treatment at that point. Stage 4 lung cancer is not a curable endeavor. So really trying to focus on what the wishes are of the patient, and if they're healthy and they want to proceed with treatment. Our goals are really to prolong quality of life, and that may include a combination of chemotherapy, immune therapy, or sometimes even targeted therapy. So really the important thing is trying to establish the goals the patient has for undergoing treatment. And a part of that, we also talk about their overall health status, because that could influence a lot of what we're able to do as far as the menu of options for therapy. If someone has significant kidney disease, you have to kind of determine what medications you can use or influence, or worsen toxicity. So we would have to take into account their overall health status during treatment. And also, I think it's important to know or get an idea what sort of support systems the patients have, because if they are going to proceed with therapy, there's going to need to be a support situation to help them through it. So that's sort of initial goals with advanced stage 4 cancer. The other stage of cancer where we may not use a surgical treatment is stage 3 lung cancer, where it's a combined chemotherapy and radiation strategy. Now, goals are a little different there. Those are still to cure the cancer if we catch it stage 3 disease. Still not as much success as earlier stages, but patients, there's a lot of toxicity with that because you're combining both chemotherapy and radiation together. And also now the standard is immunotherapy with that. But recently, one of the more kind of groundbreaking trials, there's now about 50% at 4 years are alive with stage 3 disease with a combination of chemotherapy, radiation, and immunotherapy. So that's a discussion with patients. It is stage 3. If they can handle treatment, there's still a different sort of goal of treatment there.
Thank you, Dr. Vaughn. It sounds like a very comprehensive approach. Dr. Sherwood, what is recovery like for patients who will undergo surgical treatment?
First, I'd like to help the audience explain who is a candidate for surgery. And one thing that has been evident with the lung cancer screening trials that have been undertaken in the past is that we've seen about a 20% reduction in death from lung cancer in patients who undergo screening. And again, those are the high-risk patients that are stratified into this screening program. And typically what we'll see is early stage lung cancer that is treatable with surgery. And again, the earlier you are diagnosed, the better your chances for your cure. And we can apply local therapy and treat with local therapy early stage lung cancer, then we have a higher chance for curing the cancer. And surgery for early stage lung cancer is really the mainstay of therapy. Traditionally, when people think about surgery for lung cancer, they think about a big cut on the chest and something called a thoracotomy. And people like to say, you're going to crack the chest to take the lung cancer out. Well, we used to do that 20, 30, 40, 50 years ago. But over the past 20 years, we've perfected our techniques with minimally invasive surgery. And that's either performed with a scope and some small incisions or a robotic approach. The scope approach is called a video-assisted thoracoscopic surgery, also called VATS. And that allows us to access the chest cavity and the cancer location, remove it with these minimally invasive techniques, which result in a shorter recovery time. And a lot of that's a consequence of less stress during the surgery and also less pain after the surgery. And therefore, patients are better equipped to recover more quickly, whereas in the past it might be a 7 to 10 day hospital stay. Now our average stay is about 2 days, and then we do a lot of the recovery in the office. And one thing I always tell patients is that the better you come into surgery, the better you come out, because we're operating on the lung, and patients who are smokers tend to have underlying lung disease such as COPD or emphysema. We always ask patients if they are still smoking to quit smoking before surgery, and also we'll put them in a rehab program that may improve their performance status or their physical ability to withstand the surgery and to recover. So it's a comprehensive approach to improving recovery after surgery that really works well.
It's amazing to see how far technology has come with treatments.
Indeed.
Dr. Mokhtari, we've discussed the intricacies of lung cancer screening, treatment, and recovery, but can you tell us a little bit about the prevalence of these cases in our area?
Based on the reports, in 2019, actually 22.5% of Virginia high school youth reported currently using any tobacco products, including e-cigarettes. And among Virginia high school youth, 5.5% reported currently smoking cigarettes. So it's I would say that it's pretty common in young population. Based on CDC report, $1.8 million was received from CDC for tobacco prevention and control activities in the fiscal year 2020. And 14% of adults smoked cigarettes in 2019. These are all data from 2019. And 10,300 adults die from smoking-related illnesses each year. And also, they reported that $3.1 billion was spent on healthcare costs due to smoking in 2009. That's a little bit older report. But anyway, looking into this data, seems like smoking is a very active problem right now, specifically starting from younger population, and gradually they reach to the age that the chance of getting lung cancer going to be higher. As Dr. Sherwood explained, that goes with pack year calculation, and the more you age, the more you smoke, the higher chance of getting lung cancer. So it's really, really important to diagnose these cancer at earlier stage. Just like what Dr. Vaughn explains, a lot of these cancers, when they're diagnosed at advanced stages, the treatment goal is not cure. Actually, it's going to be just improving survival, but not curing the lung cancer. It's only curable at very early stage 1 or 2. So stage 3 is still questionable if can be curable with chemo radiation. So it's really, really important to diagnose at very early stage, and we should not wait for symptoms, like I said, and start screening in an appropriate population.
Absolutely. Those are some astounding figures. So Donna, how does a cancer nurse navigator support a patient with cancer?
Thank you for asking. The navigators support patients and their families by helping them guide them through the healthcare system and overcoming any type of barriers to care. The Regional Cancer Center at Mary Washington Healthcare offers services such as the navigators, and counseling, integrative medicine, nutrition. We have genetic counseling and financial counseling, as well as support services, support groups.
Thank you. And I know the Mary Washington Healthcare Regional Cancer Center is accredited by the Commission on Cancer. Can you just tell us a little bit about this accreditation and why it's important for our patients?
Sure, we abbreviate that by the COC, the Commissioner on Cancer. It's a voluntary service and it's done every 3 years. It's important for the patients because it holds us to high standards, and to become accredited, we go through measures like quality measures, improvement projects, and community outreaches like this one. Our current quality improvement project is Just Ask, which is what we're doing with patients, is asking them about their history of smoking and advising them of the negative effects and of during their cancer treatment, and assisting with quitting or referrals. And it's important to also know that not all patients with lung cancer have a smoking history. And it is also very important to report all of the history of smoking.
Thank you so much, Donna. For the next portion of our Ask the Expert Live, we're going to jump to some questions from our audience. Dr. Brandt, we've talked a lot about screening for lung cancer. What should patients expect to be the next step if something abnormal is found at their screening?
Sure. So just to remind everyone, when we are screening for lung cancer, what we do is actually do a CT scan of the chest, which includes basically the portion of your body that begins from like the lower portion of the neck to the upper portion of the stomach. So we're able to get a good picture as to what's going on, not only in the lungs, but also in other parts of the body that also sit in between the lungs. What we are looking out for, though, specifically are any abnormalities within the lungs that could be nodules or any kind of cystic structures that could represent an early cancer, but not only cancer, other things can show up. So depending on what we find, we might be able to do extra tests. So for example, if we're thinking that a particular abnormality in the lungs does represent a cancer of some sort, we might follow that up with a biopsy. So that's putting a needle into the specific area or abnormality, which then gets sent off to the pathologist, and that then goes down one avenue of possible treatment. Or alternatively, if there's some abnormalities that look a little bit suspicious, but not entirely so, we might recommend to follow up with another scan, say several months down the line, to keep an eye on it, to see if there's any significant change over time.
Thank you so much. And Dr. Mokhtari, as you pointed out before, screenings are meant to find cancer in people who are non-symptomatic. So for many people, screenings may seem like an unnecessary step or worry. What words of wisdom or encouragement would you have to nudge someone to go ahead and schedule a screening?
I believe that primary doctors, play a major role in screening, or at least advising their patients that are a candidate based on their age and history of smoking, based on the pack year number. But patients themselves should really be proactive and don't wait for anyone to recommend. Basically, this community awareness is really important, that they know that their cancer can be cured if it can be detected early. So I believe that describing or outlining the treatment based on the stage can a little bit encourage them to don't wait for the cancer to be symptomatic and try to go for these screening tests earlier. Like comparing a curable surgical management rather than chemo and radiation that can be very toxic and still might not be ideal to cure the patient. So those, information, if can be provided to the patient, it might be a little bit warning to the patient to consider this as a very important screening test to go and do these screening tests early. And also, like I explained about these data, it's very, very common cancer, and we have a lot of young population that start smoking at young ages. So these are the things that patients should know about and go for a screening test, and ideally to stop smoking as soon as they can, or they can have access to, support and, helps.
Thank you so much. Dr. Vaughn, I know that there's a significant portion of the population, my own parents included, who are not smokers themselves, but grew up in smoking homes and now are worried about the effects of secondhand smoke. For people who have lived and grew up with secondhand smoke, are they considered candidates for screening?
Well, really the sort of guidelines for screening are for patients who have smoked. I think when you, the idea of screening is you want to take the highest risk population for lung cancer, just because usually we are including possibly a biopsy. So there are some potential, side effects from a screening for lung cancer. We don't want to put someone through unnecessary biopsy if warranted. So you're really trying to, for lung cancer, that's why I really have developed these really kind of specific criteria for who's at high risk. And really that is, a pack per day history and age to really kind of help guide us who needs to be screened.
Thank you. That's excellent information. Dr. Sherwood, for folks at home who are looking to prevent lung cancer, are there any steps or lifestyle habits you would recommend?
Yeah, that's a great question, because if you look at the data, 90% of lung cancer cases are related to cigarette smoking. And if you look at the criteria for screening, the number one criteria is number of pack years, which we initially placed at 30 pack years of smoking. That's 1 pack a day for 30 years. But then it's now been lowered to 20 pack years. It's 1 pack a day for 20 years, or the equivalent, and then age. So we used to screen at age 55. Now we're screening at age 50. So as you can gather from that information, if you can limit the number of pack years as much as possible, you can decrease your risk for developing lung cancer. So if you are a smoker, quitting now is the best thing you can do for your health. And we do know that the earlier you quit smoking, the safer you can return to a baseline that does not include a high risk for lung cancer. There are about 10% of cases of lung cancer where genetic mutations are the main driver for lung cancer. And sometimes if you have a family history of lung cancer, it might be helpful to talk to a genetic counselor to see if there's any genetic testing that would be considered to assess your risk. And then you may be a candidate for a screening if you're considered high risk. If you are a smoker, we do have services at Mary Washington through our doctor's offices or through the Navigator program for smoking cessation. And that's a comprehensive program that includes nicotine replacement, because your body does develop an addiction to nicotine. It's a scientific fact that patients who smoke are addicted to nicotine. Also, there's the habit associated with cigarette smoking. So replacing that habit with other mechanisms is also part of the process. And then we also have drugs that help curb the craving for nicotine or for smoking. And there are a couple that are out there that are very effective that you can discuss with your doctor, which is best for you.
Thank you so much. It sounds like there are options, and we are definitely here to help. Dr. Brandt, one last final question. I know there's been a lot of talk recently in the media and all over about e-cigarettes, vaping. Do we have any information on how that translates? Is it like the same as smoking a cigarette?
Right. So, e-cigarettes is certainly kind of the new kid on the block. Since they haven't been around for as long as cigarettes, I don't know if the data to suggest that they might increase someone's risk of developing lung cancer is as elevated as with tobacco or just cigarette smoking, but I would assume, I think it's still pretty high. But again, it's something that ideally, if you can avoid it, that's probably the best thing you can do. Just with anything that delivers tobacco or nicotine into your body, there's going to be some sort of a risk with it. So that's my answer on that.
Thank you. I appreciate it. I'm sure many parents at home are appreciative of it too. All right. Well, thank you to our panelists for sharing your time and expertise. And thank you to you, our viewers, for tuning in to Ask the Experts during your lunch period. If you have questions about lung cancer or want to learn more about our services, we invite you to visit our website for additional resources. You can find us online at cancer.mwhc.com. And be sure to watch the Mary Washington Healthcare Facebook page and other social media channels to stay informed of the latest health and wellness information for our community. Again, many thanks for joining us this afternoon. Please stay safe and healthy and have a good rest of your day.